So the first thing I'm going to do is check the medical record to make sure that I should be changing the dressing, frequency, and what kind of dressing change we have. Check that, so I'm going to go into the patient's room. Hi, Mrs. Jones. Can I come in?
Yep.
Hi, Mrs. Jones. My name is Sophia. I'm with Purdue Northwest. I'm going to be your nursing student today. Could you tell me your name and date of birth, please? Okay, very good. So I came in here today to do a dressing change. So what I'm going to do is take off the old dressing on your abdomen and put on a new one. Does that sound okay?
Mm-hmm.
Okay. Do you have any pain right now?
Mm-mm.
All right. If the patient were to have pain, I would administer the proper medication. If it were IV, I would wait about 15 to 30 minutes. And then if it were oral, I'd wait about 30 to 60 minutes. All right, Mrs. Jones, I'm just gonna raise up your bed. All right, got it at the waist level. I'm gonna get my supplies ready. I would have this at the waist level if there were another one available. Perform hand hygiene. And put on some clean gloves. All right, Mrs. Jones, I'm going to pull your blankets back so I can see your wound.
Only if we have to.
All right, I'm going to take off your old dressing. I'm going to use the push-pull method to prevent any medical adhesive related skin injuries. All right, now that I have all of the tape off, I'm going to pinch and pull up the old dressing, and I'm going to look at the old dressing for any drainage. I'm checking for type, amount, color, and odor if it has any. If it doesn't, so I would then drop this into the garbage can. Put it here for now. And now I'm going to look at the incision. I note that there are staples, so I would chart that. I would also be looking for any erythema, irritation, drainage, or anything new around the wound. All right, Mrs. Jones, I'm going to get all of my supplies ready to put on the new dressing. Perform hand hygiene. Just a little closer. First thing I'm going to do is set up my sterile drape. I'm going to pull this away from my body and grab the corner. Drop this into the garbage can. I would not let that touch the table. And now place this down. Going to open my abdominal pad. And drop this into the garbage. And drop my and I would then take out the medication from the package and squeeze a dollop size amount onto the sterile pad at least 2 inches away from the border. And then since I forgot to measure my wound before I put on my sterile gloves, I'm going to go back and measure that to see that it's a little bit over 12 centimeters, so I would put that into the chart. And now I'm just going to rip my tape for my wound, change. It's not working. There we go. Okay. Now I'm going to perform hand hygiene. And I'm going to label my piece of tape with my name and the date and the time. From hand hygiene one more time and start with my sterile gloving. I'm going to pinch this one. And scoop. And now that my gloves are on, I can touch my sterile field. So I'm just going to set up. Alright, so now that I have all that set up, I'm going to put some of the medication onto my Q-tip and work downwards of the wound. And I'm going to drop that from a sterile height. And then now I'm going to place my gauze. And my abdominal pad. I'm going to place my initials in the top corner, so that way we can still see if there's any drainage. Everything looks good, so I'm going to pull your gown down, Mrs. Jones. Pull up your covers and dispose of everything. If my gloves were soiled, I would take them off. Lower the bed back down. So the bed is in the lowest position and the call light is in place. Mrs. Jones, is there anything else I can do for you right now? All right, I'm going to take off my gloves, perform hygiene, and step out.